We all know the warming of our planet is a big issue, certainly one of the greatest issues of our age.
The health argument for climate action is crystal clear. The same unsustainable choices that are killing our planet are killing people.
World Health Organization Director General Dr. Tedros Adhanom Ghebreyesus. But how often do we really think about the climate crisis as specifically a public health emergency?
Human health depends on the health of the planet that sustains us.
Too often, people are looking at climate change through an economic lens, through an environmental lens. If we push forward the fact that the climate crisis is a health emergency, that may help move things faster and further.
If we were to continue with business as usual emissions, with warming up to 3.7 degrees by the end of the century, then we could see an additional 4.7 billion people being at risk of these mosquito-borne diseases.
Nearly 5 billion extra people at risk, and that's a projection relating to just two specific diseases, malaria and dengue fever. As we hear in this episode, this barely scratches the surface of climate change's likely impact on health.
There are just so many pathway exposures, from direct impacts of heat and storms to food system failures, infectious diseases, of course, the very climate-sensitive vector-borne diseases carried by cold-blooded insects. That's why I view this as one of the most serious challenges that we face in our lifetimes.
I'm Maggie Silver from the communications team at the U.S. Centers for Disease Control and Prevention. In this episode of Eye on Yellow Fever, we examine the danger to public health from global warming.
The risk of outbreaks of the deadly disease yellow fever is both significant and growing. This is down to a cocktail of contributing factors, including climate change and increasing pressure on land, greater movement of people, particularly into cities, and a resurgence in our highly connected world of the mosquito species that carries and transmits the disease. Yellow fever may not be the most obvious global public health threat, but it's a disease with no cure and a growing risk that must be taken seriously. We are Eliminate Yellow Fever Epidemics, that's I for short. From the world's most senior public health experts to those on the front line of combating this deadly disease wherever it emerges, we have the inside story on yellow fever's expanding global risk. This is Eye on Yellow Fever.
Welcome back, and thanks for being with us. In our previous 3 episodes, we focused pretty tightly on issues around yellow fever. This time, we're zooming out to look at a bigger picture, because quite clearly, climate change impacts much more than just yellow fever. We do so in the company of some preeminent guests joining us from either side of the Atlantic.
My name is Rachel Lowe. I'm an Associate Professor and Dorothy Hodgkin Fellow at the London School of Hygiene and Tropical Medicine. I lead a group of researchers working between the Centre on Climate Change and Planetary Health and the Centre for Mathematical Modelling of Infectious Diseases. And my research focuses on the impacts of environmental change on infectious diseases.
We'll hear more from Rachel in the second half of the episode, but first, to someone who's been giving consideration to the warming climate's impact on global health since before many of us even noticed it as an issue.
Well, Maggie, thanks for having me on this podcast. I'm Professor Jonathan Patz at the University of Wisconsin in Madison, where I direct the Global Health Institute, and I've worked on climate change health effects for about 27 years. I co-chaired the first health report for the U.S. National Assessment on Climate Change, report to Congress, and served on the UN Intergovernmental Panel on Climate Change for about 15 years. So I've been pretty dedicated to working on the health impacts of climate change.
And so back in 1994, when you were hosting this first session on climate change for public health, what was the response at the time from the research community and from the public health community?
Well, back in the mid-1990s, when I jumped into this, my supervisors at Hopkins asked me, why am I working on this issue? Many people didn't realize that public health was a core central concern when we're looking at climate change. So it's really a sidelined issue, not at all in the mainstream. Climate change is now really understood as a health emergency, but back then, not at all.
You have previously described climate change as the mother of all threats to human health. Can you talk a little bit about why you believe that?
Well, really, when you look at the way climate change affects our health, there are just so many pathway exposures. Heat waves are, very direct effects. But of course, it's not just about temperature. It's about extremes of the water cycle, more droughts, more fires, more flooding, food system failures, infectious diseases carried by cold-blooded insects. Only half a degree of warming can affect their transmission dynamics tremendously. And the drivers of climate change, which are burning fossil fuels that are heating the planet, burning fossil fuels cause hazardous air pollution that kills upwards of 7 to 8 million people every year. So this is a really serious problem. It's not just a single agent of disease, it's multiple exposure pathways, and it's why I view this as one of the most serious challenges that we face in our lifetimes.
That's a succinct and sobering sketch of the interconnected weave of issues. Refocusing on our key theme of vector-borne diseases, including, of course, yellow fever, there are significant challenges due to a warming climate. And interestingly, Professor Patz explains that we don't have to guess or even predict what a warmer, wetter climate will do to vector-borne disease patterns. That's because we get the chance ourselves about twice a decade to look into the future because of the El Niño weather phenomenon.
We have a window into the future when we look at El Niño that happens about every 3 to 7 years on average, and you see unseasonable rainfall and temperatures, and we actually see a response in infectious diseases from those extreme climatic conditions. We see increases in the risk of cholera in the Bay of Bengal during El Niño. We see changes in dengue fever in Southeast Asia. These are, climate-sensitive diseases that we're going to be seeing a change in response.
As disease-carrying mosquitoes require warm, wet weather, cooler places at higher altitudes can currently be considered relatively safe. But as temperatures creep up, so will the mosquitoes and the diseases.
So for every 1,000 meters in elevation change, we see a 6 degrees centigrade cooling in temperatures. So as the highlands become warmer, they'll become more suitable for transmission of diseases like malaria, for example.
Worse still, the higher altitude community may have much lower immunity to the newly arrived disease than populations where the disease has been endemic, making its impact potentially much more harmful. Professor Rachel Lowe.
We're particularly seeing this happening, for example, in previously cooler areas into the south of Brazil, also moving into highland areas which are becoming warmer. So we're seeing more parts of the globe are environmentally suitable for the mosquitoes to become established and the diseases to spread, particularly in communities that have very little immunity to these diseases. So we need an improved understanding of the potential expansion of these diseases. And we also need to improve our partnerships between vector control teams and climate scientists, policymakers, to ensure that areas are prepared to eliminate mosquitoes and protect populations from the spread of these diseases. And this can particularly be done through environmental hygiene education campaigns and understanding better connectivity patterns between areas where these diseases are endemic and those areas which don't yet have these diseases but have the environmental suitability for them to become established.
Most people understand that increased rainfall and humidity leads to more danger from disease-carrying mosquitoes. But, perhaps counterintuitively, a shortage of rain can also lead to a greater mosquito risk, particularly in populated areas.
A lack of rainfall, like drought conditions, can also lead to additional water storage, which can also impact mosquito breeding. We've been looking into developing models to try and disentangle the impact of climate change from other socioeconomic factors. We recently published a study where we were projecting changes in the length of the transmission season for both dengue and malaria, which are two of the most important vector-borne diseases worldwide. And we found that if we were to continue with business as usual emissions, with warming up to 3.7 degrees by the end of the century, then we could see an additional 4.7 billion people being at risk of these mosquito-borne diseases. Whereas if significant action were taken immediately to curb those emissions and keep warming below 1 degree C, then that increase would be reduced by about half.
We'll hear more from Professor Lowe and Professor Patz shortly, and we'll particularly look at what can be done to mitigate some of the serious health effects of global warming.
Activism is becoming more important to put pressure on governments to act, improve mitigation within the public health sector itself, which has very high carbon emissions, so to lead by example.
This is episode 4 of a 10-part series from our I-Team and partnership. To learn more about us and our objectives, see the link in the show notes for this episode in your podcast player, or just search online for Eliminate Yellow Fever Epidemics. We release new episodes every second Friday. As with all podcasts, if you want to get episodes automatically downloaded to your phone or device, just click subscribe or follow now. To start this second half of the show, I'm going to introduce a new voice to add some important context on mosquito breeding habits.
I maybe spent 25 years of my career chasing these vectors, mosquitoes, sandflies, and so on, into so many fields in the world.
Professor Florence Fouque is a vector control specialist at the World Health Organization. She works closely with teams who literally scour homes and communities that are at risk of mosquito-borne diseases like yellow fever to eliminate open water sources. Even the tiniest pool of water can be a breeding ground.
On the back of the fridge, you have a little container which take the water which come out from the fridge. So the water is quite cold, but out in tropical places, it is, I would say, hot enough or cool enough to be able to receive mosquitoes. And nobody think about this place for breeding. And so you don't think about this one, but there is thousands like that. So this is the difficulty. So they can breed in almost any single little pots of water. And then it's very difficult to control them, because if you suppress that place, a pot of water, then they go to another one. There is people which are trained to go into houses, explain to people, look for breeding sites, even in the gutters, everywhere where they can find water.
However, in a significantly warmer world, there's only so much vector control and mitigation that is going to be possible. Earlier, Professor Lowe described her finding that a business-as-usual level of global warming, that's 3.7 degrees Celsius, could see 4.7 billion new people put at risk of dengue and malaria. If the world can keep warming below 1 degree Celsius, the increase in people at risk would be around half that. For both Professor Lowe and Professor Patz, there is an obvious conclusion to draw.
It's very important that we do everything we can to curb our emissions, to reduce the negative impacts of climate change, because a warming and less predictable climate, that creates the perfect storm to make a large proportion of the world very vulnerable to outbreaks of these diseases.
You know, with the global climate crisis, the whole world is at risk from increases in diseases. But there are many places, especially in low-income settings, where individuals are more exposed to the natural environment. There's less infrastructure as far as disease prevention and disease surveillance. In many ways, this is the largest ethical dilemma that we face. Climate change is the greatest ethical crisis of our times.
And are there certain things that you would say that we need to prioritize in order to mitigate the impacts of climate change on public health?
I think education is key to understanding that climate change is a health problem. Activism is becoming more important to put pressure on governments to act, improve mitigation within the public health sector itself, which has very high carbon emissions. So to lead by example, the public health services can take action and help educate the public about the importance of moving to more sustainable practices. But so much more needs to be done. For example, health should be at the forefront of the COP26 discussions, but it features very little in the agenda at the moment.
Maybe as a health scientist, I'm biased, but I really think that most of the world doesn't see the climate crisis as a health emergency, and people care about their health more than about anything. So that would be my recommendation.
And governments really need to realise that the climate crisis is a health crisis, which will have far-reaching impact well beyond what we have witnessed with the COVID-19 pandemic, for example.
And I view this as our greatest threat because of all of those exposure pathways from climate change.
This episode has tried to stick closely to specific issues around global warming and disease control. Climate change, of course, sits within a complex, interconnected web of other issues, including deforestation, environmental forced migration, land use change, increased urbanism, and mass movement of people from rural areas into often unsanitary conditions in slums and favelas in big cities.
And of course, if we have disasters and failures of agriculture, you'll see refugee migration. So, I think this threat of forced environmental refugees could be the tip of the iceberg.
Populations who are living in unsuitable accommodation that isn't well serviced. So these poor environmental hygiene conditions particularly affect poorer communities who don't have access to those basic sanitation needs or access to good public health care.
So if you're wondering why we haven't gone more into any of those important and interconnected topics, well, that's where we're heading next time in Eye on Yellow Fever, Episode 5, Cities at Risk. Huge thank you, of course, to Professor Jonathan Patz and Professor Rachel Lowe for sharing their knowledge with us, and to Dr. Florence Fouque for her vector control expertise, too. You can search online for Eliminate Yellow Fever Epidemics. Look in the show notes on your podcast app to find that link. Word of mouth is so important when it comes to reaching new audiences with podcasts. So please, if you can, think of someone you know who'd be interested in Eye on Yellow Fever and send the link to them. You can also select subscribe or follow to make sure that all future episodes of Eye on Yellow Fever are automatically downloaded direct to your device. This episode was produced by Dave Howard with research from Amelia Jansen and sound design by Adam Whaley. I'm Maggie Silver. Eye on Yellow Fever is a Bango Media production for Eliminate Yellow Fever Epidemics.